Welcome to the MS-Perspektive podcast. Perspective with a K, as I'm German. I'm Nele Handwerker, MS patient, patient advocate and author. I'm bringing you interviews, inspiration and information about living with multiple sclerosis and show you ways how you can positively influence the disease and make the best out of your diagnosis. On ms-perspektive.com, you will find the show notes, 11 free tips as a PDF, and lots of other information. And now the show begins.
This podcast is supported by Mid-Mission, a project of the nonprofit Hertie Foundation.
Hello and welcome to episode number 14, Smoking and MS, an interview with Dr. Claudia Marck, and there she will explain why and how to quit smoking. Smoking is really one thing where you can improve your prognosis quite a lot. And that's why, even though the interview was recorded originally in April 2023 for the German podcast, I wanted to share it here again. And I think it might be very interesting for you as well. So enjoy the interview. Hello, Claudia. It's a pleasure to have you today on the show, and a warm welcome to Melbourne.
Thank you so much for having me.
Yeah, because before we start with the interview, could you please introduce yourself so that the listeners know who is here on the show today?
Yeah, of course. So my name is Claudia Marck. I'm a senior research fellow at the University of Melbourne in Australia. I am originally from the Netherlands, which is not very far from Germany. But in about 15 years ago, as a student, I came to Melbourne to do a research project, and I fell in love with Australia and with an Australian. 15 years later, I'm still here.
Great. Sounds good. One of my best friends is living since more or less the same period in Australia and always moving around a bit. I think right now he's at the Gold Coast. Yeah. So what was your personal motivation for your career choice?
Yeah, so I think, MS, as you and many of the listeners will know, is a disease that impacts many people from a really young age, and it often can have quite a profound impact, especially in the years where you're trying to build a career or a family, when you're in your 20s, 30s, 40s. And people live with MS for a very long time. So I think any improvements that we can make to quality of life of people with MS will have quite a big impact. And with my work, I hope to find ways that I can help people with MS to live healthier and happier lives. And I think that helping people to quit smoking hasn't really received enough attention in MS research, but also in MS clinical practice. So that's where my work's focusing at the moment. I'm doing a lot of other things as well, but smoking is a definite sort of focus of my research. And as someone who used to smoke a pack a day a very long time ago, as I quit smoking 15 years ago, but I know how hard it can be to quit smoking. So, I'm not here to sort of make anyone feel guilty or blame anyone for continuing to smoke. I'm here to try and help people to quit smoking if they can, if they want to.
That sounds great. And it's so important. I think it's really so important. I saw quite some other patients who keep on smoking and it's not so good for their health, and some other ones who were able to quit and really it helped so much with the MS. Okay, so let's go to the existing evidence. Which effect has smoking on the onset of multiple sclerosis?
Yeah, we have quite convincing evidence now that smoking increases the chances of developing MS. And this is even more pronounced in people who have some genetic susceptibility to developing MS. So there's an interaction between genetic susceptibility and smoking that really increases the chances of getting MS. And that's also for passive smoking. So passive smoking means if you're around people that smoke and you might breathe in the smoke that they exhale, passive smoking also increases the risk of MS. And this is really important to know for people. So for instance, for children of people with MS, so they might already be at a slightly higher risk of developing MS because of the genetic vulnerability that they get from their parents. But one study has shown that children whose parents are smoking around them, the children had high risk of developing MS at quite a young age. And the longer they were exposed to the smoke, the higher that risk was. So those things are really important to know, I think.
Yeah. So it's not just the smoking, yes or no, but as well the amount and longevity. Yeah. How does smoking contribute to the disease and the disability progression?
So once people who have been diagnosed with MS continue to smoke, they are worse off than people who stop smoking at the time of diagnosis. And that has been shown in studies that have looked, for instance, at brain lesions using brain imaging studies. It's also from long cohort studies or longitudinal studies where they followed people over time, where they've looked at, for instance, the number of relapses that people have, but also the disability progression. So studies that have followed people with MS over long periods of time have shown that people who continue to smoke develop, for instance, walking difficulties quicker. And several studies have also shown that people with relapsing remitting MS who continue to smoke reach the progressive stage of MS, so secondary progressive MS, quicker than people who don't smoke or who quit smoking. Yeah. Now, there's also a study that showed that persistent smokers reach the progressive stage of MS 8 years earlier compared to those who quit after diagnosis. So 8 years is, it's quite a profound effect. If that is something that we could achieve, for instance, with a drug, that drug would be very popular. And, other than MS, we also know that smoking impacts on, for instance, your heart, on your other organs, increases the risk for cancer. And, therefore, it's never too late to quit smoking. Even if you've had MS for a very long time and you've smoked for a very long time, quitting smoking now will be one of the best things you can do for your health.
Yeah. That's so extreme. I mean, 8 years, that's so much. When you think about the quality of life that you could proceed for such a longer time. How many people are smokers at the time of diagnosis? Is there something known?
Yeah. That's a really good question. It's a little bit unclear. There is some evidence to suggest that people with MS are more commonly smoke compared to people without MS, but there's really a lot more research needed in this area to understand the numbers. And it's also different for each country. So in Australia, where I live, we've had a much stricter regulations for smoking advertisement, for instance, and a pack of cigarettes is much, much more expensive than in Germany. So if you look at the general population in Australia, the proportion of smokers is about 11%. And in Germany, I believe that's double. So it's, depending on which study you look at, it's somewhere between 22 and 28%. So that's a lot more smokers in Germany than in Australia. And of course, that translates to people with MS as well.
Yeah. And it makes it totally clear. I like to go by train to through Germany, and I was once going in the train with some people from Australia, and they said, wow, so many people are smoking here. And the Germans, they are so stressed out and that they smoke so much. It's not good. But yeah, of course, if it's just half the amount in Australia, I can totally understand their comment.
Yeah, it's really different here. You're not allowed to smoke in a lot of places. And because it's also very expensive, I think it just really deters people from smoking. It's really, the public health messages have really worked here.
Yeah, it's good. I think we have probably too many smokers in our public health system who don't want to beat themselves. What does smoke do? What does smoke do to the body and brain? And is there a difference between normal cigarettes and e-cigarettes?
Yeah. So to answer the first part of your question first, as we age, for all of us, our brains will slowly shrink a little bit. And smoking has been shown to speed up this process because the smoke that you inhale every day causes injury to your brain cells day in and day out. And, there's also metals, many chemicals, which can cause cancer. They can damage your blood vessels. They damage the lining of your lungs. They damage the heart muscle and pretty much every other organ in your body. So most of us already know this, but smokers generally die younger. And this is also the case for people with MS who smoke versus people with MS who don't smoke. Now for your second part of your question, there is no evidence to suggest that e-cigarettes are not harmful. They often have a lot of chemicals which have the potential to be harmful. E-cigarettes or vapes, they haven't been around for long enough for us to know what the long-term health consequences are. But the current health advice around e-cigarettes is to not use them unless they're prescribed by a doctor specifically as a temporary tool to quit.
Mm-hmm. Okay. Which ingredient seems to be the most dangerous one? And is it present in chewing tobacco as well? I mean, chewing tobacco is not very popular in Germany, but I know it's in some other countries.
Yeah. It's a good question. I don't know which the most dangerous ingredient is, but some of the dangerous chemicals in tobacco smoke include formaldehyde, lead, arsenic, ammonia, tar is another one. So tar is the chemical that stains fingers and teeth of smokers, often like this yellowy brown color. Mm-hmm. Studies have shown that nicotine, while nicotine is the addictive substance in smokes, is not actually what causes the harms to your health unless you consume nicotine in really large doses. It's not actually that harmful for you. It's mostly the other chemicals and the smoke from cigarettes and cigars or other tobacco products that do most harm. And this is really important to know because it means that nicotine replacement products, so for instance, the patches that you can get or the chewing gum that you can get that has nicotine, they can be really helpful with quitting, and they are safe for people with MS. So we've, looked at this with some of the people that are involved in Quit Victoria. So that's an organization here in Australia that helps people quit. They have pharmacists and other people working for them. So we've looked at MS medications and nicotine products. And as far as we're aware, there are no known interactions between MS medications and nicotine or other quitting medications. Now, for the second part of your question, as far as I'm aware, there's no strong links between chewing tobacco and MS, but there are other health risks, and therefore it's better not to use those products.
Okay, yeah. Has smoking any impact on the success of disease-modifying treatments?
Yeah, there's a couple of studies that have shown this. So smoking impacts on how effective some MS medication is at slowing relapses. So one study looked at natalizumab and another one looked at interferon beta and have shown that these drugs were less effective in people with MS who smoke compared to people with MS who don't smoke. And because these medications are designed to slow down MS and MS relapses, of course, we don't want to interfere with their efficacy. So, yeah. And again, I guess it's important to note that there's no side effects between nicotine replacement therapies like the chewing gum and the patches and these medications. So it's something to do with the smoke and the other chemicals.
Okay, yeah, totally interesting. I mean, I was aware of the interferon beta study, but not of the natalizumab one. Very, very interesting. What is the effect of smoking on the quality of life for people with MS?
That's a very good question. So it's a little bit difficult to answer because sometimes it's hard to know what the cause and effect is. So we know that people, for instance, people who have more difficulties in life are more likely to smoke. And this worsens their health. And we know that people who smoke have worse health, which may then mean that they have more difficulties in life. So it's a little bit, hard to say what's the chicken and the egg. But we know that people, for instance, with depression or pain can have more difficulty quitting smoking because smoking can give a sense that there's a temporary relief in symptoms, for instance, like pain and depression, even though it might make it worse in the long term. So we do know that once people quit, their mental and physical health improves.
Yeah, so we can go the spiral down or we can go it up, right?
Yeah,
we can go in both directions. It's in a way our decision, which way we choose. Yeah. What happens when smokers become non-smokers, and how long does it take to see positive impacts on the disease progression?
Yeah, so just to clarify the positive impacts, I guess, studies have shown that the damage doesn't necessarily resolve when people quit smoking. So it's really difficult to undo damage that has been done. So you may not necessarily see improvements, but the rate of worsening, so for instance, to do with disability or mobility, that will slow down to be similar to people who have never smoked with MS.
Yeah. And I think that's already enough to think about stopping to smoke. Yeah. How many people with MS succeed in quitting smoking? I mean, I know it's always hard for people. I know many who are not able, who don't have MS, but who don't ever succeed.
Yeah. I mean, it's really difficult for me to answer the question of how many people succeed with quitting. We know that many people do succeed. But we also know that people really need a lot of help with this. Some of the studies that I've mentioned before, they follow people with MS over many years, sometimes 10 years. And those studies report that people who quit smoking over the course of those studies do a lot better in terms of their MS and their outcomes, their mental health and their physical health than people who don't quit. But I can't tell you how many people succeed with that necessarily. As I said, I think there's a lot more research that's needed in this area. So I'm really hoping to contribute to that.
Yeah. It's I think a very important direction. Is there a positive outcome for people with MS who manage to reduce their smoking if they are not able at the moment to quit, but maybe reduce?
Yeah, I think there is. So some of the studies have shown that there's a dose-response relationship, meaning that the more you smoke, the worse your health outcomes. So these studies suggest that reducing the amount of tobacco you smoke will actually be helpful in your health outcomes. But it's important to note there is no safe dose of smoking. So it's not like you can, smoke a few cigarettes a week and have no health effects of it. Any amount of regular smoking, whether that's daily or weekly, will likely do some harm to your health.
Yeah. That's an important statement. And then, of course, not surprisingly, but maybe for some people, it's first reducing and then at one point stopping. Let's talk about strategies to quit smoking for people with multiple sclerosis. What are the most important barriers to smoking cessation?
Yeah, it's really difficult to quit. As I mentioned before, I smoked myself a pack a day. I had to try a few times to finally being able to quit forever. Nicotine is in the top 3 most addictive substances together with crack, cocaine and heroin. So it's not surprising that people find it difficult to quit. Plus the other thing that makes it really difficult is that the tobacco industry makes a lot of money off selling cigarettes, and they're very cunning. They use a lot of tricks to get people hooked on cigarettes, and they make it very hard to quit. So, for example, they use chemicals to enhance the addictive qualities of nicotine, such as ammonia. They also use design features, such as the filters that you have in cigarettes, to get the smoke even deeper into your lungs. And of course, we know that, once you quit smoking, you will experience nicotine withdrawal effects, and they can be, things like irritability, you can get headaches, you can get insomnia, all sorts of strange symptoms. And, that makes it really hard to quit because you know that if you light up another cigarette, those things will go away. You may also be temporarily more sensitive to pain. You may experience symptoms of anxiety or other mood disorders. And, all of those things contribute to you wanting to pick up smoking again. So I think those are, some of the biggest barriers to quitting.
Yeah. Okay. Now you described the physical dependence. How long does it last?
Yeah. So some of these physical withdrawal effects usually become less after about 3 days, and they should be mostly gone after about 2 to 4 weeks. Sometimes these short-term nicotine withdrawal effects may even be confused with MS symptoms. So it's really important for people to know that, you're going to get withdrawal symptoms, and they might feel really scary, and they might feel like, for instance, a relapse. Mm-hmm. And therefore, it's really important to get support during this crucial phase of quitting. So in this short-term period of time, it's really important that you get, for instance, help from your GP and other healthcare professionals who can really monitor your symptoms and help you with these withdrawal symptoms. It's really important to keep in mind that in the long term, quitting is really beneficial for all aspects of your health.
Yeah. Are there certain strategies that seem to be more successful for smoking cessation?
Yeah, we know from the research that you have a much better chance of quitting long term if you use a combination of quitting medication and counseling. So, as I mentioned before, it's really important that you're well supported while you're quitting. It's extremely difficult to do it on your own. In fact, it's almost impossible to do it on your own. So I would really recommend speaking with your family and or friends or carers about why it's so important for you as a person with MS to quit, and really ask them to help you. I would also recommend speaking to your family doctor and discussing options for counseling and quitting medication. So, for instance, nicotine replacements, such as nicotine patches, chewing gum, you've got inhalers or sprays or lozenges, all sorts of things. You can also get medications such as varenicline, I think it's called, or bupropion. And, you know, all these things will help. But despite all of these therapies, you often will still experience some withdrawal symptoms. So it's good to be prepared for that. There are also organizations that provide free support. I'm sure you have these in Germany. So there's, telephone support lines. There are phone apps that you can download. And, those phone apps, for instance, will really help you motivate, because they'll show you how much money you're saving every day, what the health benefits are every day. And so all of these things are really important to put into place to help you quit. So I would really try and activate if you're trying to quit at the moment, I would really try to activate all of the assistance that you can think of to give yourself the absolute best chance, because trying to quit smoking without any help is almost always unsuccessful.
Yeah. And now that you explained it, I think, yes, the few ones where now they were able to quit smoking, they were either not so addictive at all. So they did it for, let's say, fun, but of course they were addictive. But most of them, used help. They used help from the doctors and quite a variety of helping systems. And I think, in each country you can find these options for quitting to smoke. And it's normally, there are some offers by the government. There are some other offers. The offers are there. It's just you have to be willing to do so. How can dopamine be released in a healthy way?
Well, I guess this really depends on the person. When I quit smoking, I started running, and that was for me a really good way. Every time I was really struggling, I just, even if it was 2 minutes, run around the block, it would really help me to shift my mindset. And, it's different for everyone. I think other people might find that yoga, for instance, or nature or cooking, could be singing or dancing, anything that you enjoy doing that distracts you when you're thinking about smoking, will help. So it's good to think of some strategies. Some people, need something to do with their hands, or need to have, for instance, have a lollipop in their mouth, or something that will distract you from thinking about cigarettes. And over time, you will think less and less about cigarettes, once you've quit.
Yeah. See, the good friend of mine who lives in Australia, he is now a heavy gym person. So he has put on quite some muscles, and he looks better. He feels better. So quitting
has lots of benefits then. If you if you replace a habit like smoking with a positive health behavior, then you've got two benefits at once.
Absolutely. What is the situation with psychological dependence, and how long does it last?
So you might think that smoking helps you feel less stressed or anxious. Actually, that's a misconception. So the nicotine dependence from cigarettes causes, stress and anxiety. You start feeling that within hours of smoking your previous cigarettes. If it's been a few hours since you last smoked, you'll likely start to feel a little bit nervous or a little bit anxious. And then smoking a cigarette relieves that. So it's kind of this cycle of stress and stress relief that tobacco smoking actually causes. And so studies that have looked at this sort of psychological dependence, I guess, of smoking have found that feelings of, for instance, anger, frustration, irritability, which are really common when you quit, peak within about a week, and they may last 2 to 4 weeks before they subside. And again, I guess it's important to know that in the long term, quitting improves feelings of stress and anxiety, and you won't have this sort of cycle through your day that you have when you're smoking, where you're constantly starting to feel more and more stressed until you smoke again, and then it goes away and then it comes back. And so after a few weeks of quitting, you'll notice that goes away.
Sounds good. Do you have a recommendation on how to override this trained association of stress relief?
I guess all of the quitting support I've previously mentioned, but I think it's really important to speak to a counselor. If you have a lot of stress or anxiety or mood disorders like depression, it's really important to properly address these issues with a trained counselor. And that could be a psychologist, for instance, or a psychiatrist or another trained mental health support worker. So I think if you're feeling like you have overwhelming stresses in your life and you don't know how to deal with those other than to smoke, then it will be really important to get a referral to a mental health support.
Sounds good. Where do people find support who want to quit smoking? I mean, you mentioned quite some. Places,
I guess your family doctor or general practitioner, I don't know how you call it in Germany, but they should be able to support you and refer you to trained counselors or psychologists, as I mentioned before. I have the number for the German quit line here. It's 0800 831 3131. So that's the German quit line, and you should be able to call them and get free advice. And as I mentioned before, it's really important to explain to your friends, your partner, your family, why it is extra important for people with MS to quit and to not be around smokers as well. So to avoid that passive smoke, and really ask them to support you. And I think if you explain to them why it's so important for your health, that, they should be really able to understand that and help support you to quit.
Yeah, absolutely. And get over the 2 to 4 weeks where you're maybe not such a lovely person.
Yeah, exactly. Prepare people that, you might really struggle for a couple of weeks, but in the long term, it's such a good thing to do for your health. So, just those few weeks where it's going to be a little bit tricky, they are really worth it for the long term.
Absolutely. And I think everybody who loves you will do that and will go that path with you. What is your message to the ones who tried smoking cessation once or even a couple of times already and have not yet succeeded?
Many people, including myself, have to try a few times to quit before they successfully quit for the long term. It can be really hard. As I said before, the tobacco companies make it as hard as possible to quit their products because they're making money off you. So they will try and make it as hard as possible for you to quit. Look, every time you try to quit, you're one step closer to quitting forever. So I can't emphasize enough that it's just super important to get as much support around you as possible, because almost no one can do it alone. And that it's really never too late to quit.
Yeah. Okay, let's come to more another topic. So the research on MS. Which breakthrough in research or treatment for people with MS would you like to see in the next 5 years?
In the next 5 years, yeah. I think, of course, I think like everyone else, I would love to see a vaccine or some other strategy that will just prevent the onset of MS altogether. And, that's to prevent people from developing MS in the future. I guess for people who already have MS, it will be amazing to find a cure. And, we've come a long way in terms of all the disease modifying drugs that have been developed over the last few decades. We've already come a long way, but it would be fantastic to see something that will cure MS and prevent it.
Yep, absolutely. Okay. How and where can interested people find you and your research activities?
So they can keep an eye on my university website. So the University of Melbourne, if you type in my name, you'll find my most recent research, including projects and students and papers that have been published. That's probably the best place to go. I used to be active on Twitter, but it's very time consuming. So I'm not super active anymore on Twitter, I have to say. The Find an Expert page of the University of Melbourne is probably the best way to go.
Okay, and I will put it in the show notes and in the blog article, so you can look at it there. And of course, it's more important to do research for us lovely people having MS than being on Twitter. Is there anything else you would like to share with the listeners?
Yeah, I mean, we've obviously really highlighted smoking cessation today, but I want to put in context that, that's really only one part of a healthy lifestyle. So other really important things, and we've touched on it a little bit today, but looking after your mental health, addressing, any major stresses in your life, but also being physically active as much as possible and enjoying healthy diet. Those things are also really important for your health. So I guess put it into context, into the bigger picture, and look at what are the priorities for you. I think that's probably all from me.
Fantastic. Thank you, Claudia. Thank you for all the insights. Thank you for all the positive vibes, how to quit smoking and why it totally makes sense to do so and to give it a try and maybe give it a second try and maybe give it a fourth or fifth try until you succeed. Thanks a lot. And cheers to Melbourne. Lovely city. I've been visiting once, maybe the second time somewhere in the future.
Yeah, that would be lovely. If you ever make it down this way, please let me know. Thank you so much for having me on the podcast and for your fantastic work in this area.
Thank you. Bye-bye.
Bye.
I hope you enjoyed the interview and got inspired by Claudia to quit smoking if you still smoking and found a lot of interesting and well-working tips how to do that. And in case you are a non-smoker like me, please stay that way because it's really not good. I mean, it's not good for a healthy person and it's even worse for a person living with MS. And I think there are other things you can do that bring joy to your life that are much more healthier. By the way, next time I interview Peter van Galen. He is living with MS in Belgium and he is a patient advocate and he gives us some inside views into how it is to live with multiple sclerosis in Belgium. It's a very nice interview, a very nice guy, and I hope we hear us next time. Bye. Thank you for listening today. I hope you found it helpful. You may also be interested in the previously published episodes and posts, which you can find at ms-perspektive.com/podcast. Perspective with a K. You can also get a free PDF with 11 tips for your positive impact on MS at ms-perspektive.com/newsletter. If you'd like to get in touch, you can reach me at nele@ms-perspektive.com or on social media. See you next time.